I would say we are moving away from prescriber to protector, and you have to risk stratify the individual as well as in the community. So now we are going to the last talk of the day, and that also is very important because we are going to look into the low-cost tools which can be used to engage the patients between the visits. So we have Dr. Samajdar, whom you have heard in the morning as well. So he is going to talk on this particular aspect. He hardly needs any introduction nowadays. He's a prolific writer, prolific article publisher. Every week you can get one article from him. He's a good researcher. He has an excellent idea about how the research tools should be used. And further to that, he is actually believes in the aesthetics as well, I think so. And you can see his CV. I'm not going to read that. But yes, he can give you a little bit of knowledge about Kashi as well. So over to you, Samajdar.
Thank you, Dr. Patni sir. So already I think we had discussed a lot of Kashi in our previous discussion. But today our discussion is on how we can engage our patient. And I think this engagement is again very important and one of the very key person, and I think one of the very respected person from Kashi is Swami Karpatri Ji Maharaj. I think we all should have a great respect for that man. So one very interesting quote he had made, that Sangyam is one of the very key thing for two another good outcome. One is on swastha and another is on swadhana. So if you want to do a good sadhana we tell, and if you want to have a very good swastha, you should have a sangyam. So that is what we need to understand, the discipline. And our dear WA, also the first letter is D for discipline. It is diabetes, but we can say as discipline. And with permission of Dr. Patni sir, because I think 2 months ago he had a call and he asked me to prepare one consensus. And I think this is one of the very key area we need to develop one consensus, because we need to have patient being engaged, being disciplined when they are in home, right? So for next, try to finish by 10 minutes, how we can engage them with certain evidence-based tools, WhatsApp, SMS, glucose logs, what we can use. So this problem already we know that we need to overcome this problem by introducing diabetes care even in between visits. So there are challenges like non-adherence, like poor dietary monitoring, like glucose tracking infrequency, missed follow-up appointments, and lack of continuous motivation and support. So for that we need to use certain digital engagement tools which can bridge this gap between clinic visits and daily diabetes self-management in terms of glucose monitoring, patient education, medication reminders, and that ultimately translated into improved patient care. So it could be like in this way that in between clinic visits, we should engage patient with different digital tools, as we can see here. So why it is important? Yes, we already know so many millions of people are suffering from diabetes, but if we introduce this, it is going to help in glucose monitoring, nutrition tracking, medication reminder, patient education. Also, I think there are many persons who are using this technology enabled with artificial intelligence like twin system. It can give us a twin model, AI model, and we can identify those specific area where metabolic problem is arising, and we can target them in a precise manner. So ultimately we could have a better self-care behavior, treatment adherence, and glycemic control. So despite their potential sustained patient engagement and usability, this usability and patient engagement, these two words are important because they are the barriers to successful digital health implementation. So if we have certain evidences, we talk about lot on these digital things. Yes, there are evidences. We have systematic review meta-analysis. We can see almost more than 17,000 participants had been included, 34 randomized controlled trials, which suggest there is benefit in terms of body weight reduction, BMI, fasting blood glucose, and total cholesterol value. But so many RCTs, so many observational studies, and there was mixed methods, and we can see the forest plot is not convincing, and that is why we need something more focused way we need to do the studies. And if we talk about more diabetes specific studies, there are also evidences that if we use these tools, then it will translate into reduction of HbA1c at around 0.3 to 1.3%. So the take home message on self-management, if we use digital health tools, it modify the self-management behaviors, improve treatment adherence, motivation to lifestyle modification, and ultimately glycemic control. So when we talk about digital technologies, they show strong potential to enhance diabetes self-management through though the effectiveness depends on this technological usability, the patient's baseline literacy, especially the digital literacy, patient characteristics, socio-cultural context. And that is why this low-cost digital engagement is required between clinic visits, which should be simple, scalable digital tools to support daily diabetes self-management. It could be in forms of WhatsApp health updates, for an example, diet, lifestyle tips. One of our friends had developed a beautiful chatbot, and that help in understanding the diet, what is the daily calorie intake, how the glucose is swinging. So, and apart from that, diabetes education message. SMS reminders, especially on the medications, and appointment reminders, which will improve the adherence with the therapy. Medicine refill alerts, especially it is very important for improving the compliance with the therapy. Glucose logs, so it will enable regular monitoring, weekly glucose reporting, self-monitoring feedback. The thali photographs, I think already Sanwarwala sir has shown beautiful pictures of thali, diabetes thali. But also we need to ask patient, please share your meal photographs, and then we need to give the feedback. And they also should get a visual diet monitoring, that today I took this diet, so what is the calorie intake, what is the RDA, so that could help in improving their follow-up diabetes care. Diabetes scorecard, we should provide a behavioral feedback, especially tracking their key self-management indicators. It could reinforce certain positive health behaviors. And family member health coaches. So it actually, if we make some responsible family member as health coaches, they encourage the adherence to the therapy, they support in the lifestyle and medication management. So it strengthens the home-based support. So what is digital workflow? If we talk about continuous engagement between clinic visits, it starts with clinic visit, then digital follow-up, then behavioral coaching, and then again in the next visit we need to check how they are compliant with this digital follow-up and behavioral coaching, and according to that we can modify our advices. So patient engagement is the key, and I think that when we talk about adherence, the adherence word ends with E, and that E letter is very important, And that is how we should engage patient with empathy. So one of the very key reason why adherence is poor in diabetes management is lack of empathy in the care, lack of engagement in the care. So the care team could support in this way. We can add certain motivational messages, family support. So continuous digital feedback loop keeps patient engaged between clinics. So when we talk about patient engagement, we need to understand that if I am taking drug, it will work. But drugs don't work in patients who don't take them. So we had done one small study. It is a randomized control trial in our geriatric type 2 diabetes patient, where we introduced one very simple tool to improve medication adherence. And if we go by that list, with that particular supporting tool, the adherence rate improves and adverse drug reaction decreases. Apart from that medication adherence, we had also applied one clinical pharmacological reconciliation review and feedback therapy, CPRRF. That means we had gone through all the prescribed drugs to see whether there are certain interactions, whether certain duplications, whether certain omission or commissions, and if some wrong thing happened during the transition of care. So we intervene and we correct that. And actually with that device and this intervention, CPRRF, actually the patient had, more patient had reached that less than 7% HbA1c. We use this device MedPer. If you're not taking one medicine from that particular box, the signal will go to the family members who is monitoring, and the family members will call or tell the patient, his mother or father, please take this. So we had, and very recently also we got approval from NHS. They are taking this particular reminder box. So to summarize, we need to understand diabetes care happens between clinic visits also. We should have certain low cost digital tools which could extend care beyond hospitals, empower patients, enable behavioral change, improve outcome at scales. So digital engagement model offers a scalable solution for diabetes management in our resource limited settings. Thank you very much.
I think excellent deliberation.